My heart would just start racing. I'd kind of lose my breath. And usually it only lasted for a couple seconds. But as I got older, they got progressively worse and more frequent.
Robin Drabant dealt with A-Fib since she was a teenager.
Now we're applying radiofrequency energy. What that does is heats up the tissue and destroys that bit of muscle where the catheter is.
Almost 2 years ago, Robin had a catheter ablation, much like this one being performed by Dr. David Wilbur from Loyola University Medical Center. These spikes of electrical impulses, or A-Fib, show Dr. Wilbur the rapid beating in the muscle sleeves around the pulmonary veins.
The goal is to destroy the muscle around the pulmonary veins in order to prevent those transmission of electrical impulses to the rest of the heart.
Dr. Wilbur and co-authors conducted a randomized trial with 167 patients in 19 hospitals between October 2004 and 2007. All had a form of A-Fib that stops and starts on its own. 106 had catheter ablation. 61 were treated with antiarrhythmic drugs. The study appears in this week's JAMA, Journal of the American Medical Association.
60 and 70% of patients treated with catheter ablation never had another episode after the treatment, but about 30% did. In contrast, patients treated with drug therapy had somewhere between a 80 and 90% recurrence of arrhythmias over that time frame.
I can just say from my experience, it was the best decision I've ever made. I wish I'd made it years before because my quality of life is just so much more improved.
Drugs have been the mainstay for a long time. They've not been effective. We now have something that's very clearly and objectively demonstrated to be far more effective, not only in controlling atrial fibrillation and the symptoms, but improving quality of life.
I'm a normal 36-year-old. I'm very glad I did it.
Catherine Dolf, the JAMA Report.